Hi and welcome to Cardiology 101. This is Dr. Shiraz and today we are going to talk about axis and why is it so important. So first of all, I would like to talk about what is axis. So as you know, a current generates from SA node and it travels to the ventricles, to the apex of. So if you look at this slide, if I can point out here, if SA node is here, the current travels from SA node to AV node and then to the ventricle. But as you know, the heart is lying in the left chest cavity in this way. So the direction of current is like this towards the apex. So almost uh, in the line of lead 2, right? So that is our normal axis. The current travels from here, it goes to AV node and then towards the apex. So for our reference, from here, where AVL stands, the lead AVL stands, to AVF, we call this area our normal axis. From 90 to minus 30 degrees, this is our normal axis of heart. So what happens is, in some pathological conditions, for example, ischemia or anything else, this axis is shifted towards right or left or towards AVR. We will talk about this later. So let me talk about why axis is so important and why you should pay heed to axis. So I was working in Nishtar Medical University Hospital last year when a patient was brought. He was unconscious and the people accompanying him told us that he was having diarrhea and probably fell unconscious 30 minutes ago or so. We conducted ECG and somebody said that ECG was normal. But after 30 minutes, the patient collapsed. He went pulseless and we tried to resuscitate him, but he was gone. Later on, I read the ECG. Everything seemed fine except the axis, which was deviated to the right side. So the only clue that we had that he had some heart pathology was his axis deviation. So every time you see that axis is deviated to the right or left, you should pay very keen attention to it and look for any pathology in the ECG. So let me explain this figure a little bit. This is our isoelectric line, right? The one resting on the baseline in the horizontal plane. Since we know that our the flow of current is from here to here, we can say that this is our positive side towards which current flows. So 0, positive 90, this is our negative 90 and this is 180 degree. So since we talked about our normal axis that is lying between minus 30 degrees and positive 90 degree, and this should be our flow of current towards the apex. So if we look at this closely, we should see that the current flowing towards lead 1, it should be positive, right? The current is flowing in this direction and the current is flowing in this direction. So lead AVF should also be positive. Later on, when we talk about axis, we should look at these leads collectively and see if these two are positively deflected. Okay. So what happens if lead AVF is negatively deflected? So for example, the normal lead is towards this side, but if it's negatively deflected, we should say that the current is flowing towards this region, okay, towards minus 90 degree. And if our lead 1 is positively deflected, so we should say that lead is flowing, the current is flowing in this direction. So our axis should be between minus 90 and 0 degree. So if we look at our normal axis, it has been deflected towards left side. Okay, so our normal axis has deflected towards this region, which is the left side of our reference point from horizontal plane. So we will say if AVF is negative but 1 is positive, that our axis is negatively deflected. Similarly, if we have positive AVF but a negative 1 means, negative lead 1 means the current is flowing towards this direction. But since our AVF is positive, so the axis should lie here or here, between anywhere between positive 90 and positive 180. So our axis has displaced from here to here, which is a positive or clockwise deflection of axis. So we will say this is right axis deviation because our axis has moved towards right side. Right axis deviation, left axis deviation. Now we should look at extreme axis deviation, which is the case when both AVF and lead 1 are negatively deflected. If lead 1 is negatively deflected, the current should be like in this direction. If AVF is negatively deflected, our current should be flowing in this direction. So our axis would be somewhere here. Okay, we call it extreme axis deviation or northwest axis. Northwest axis. So let's talk about what are the reasons that our axis is deflected. For example, take inferior wall MI. Since you know the inferior side of heart is this, right? So if we have ischemia of this side, what happens is our left ventricle works more, the left side of heart start working more. So we have left axis deviation. Similarly, if we have ischemia of this wall, anterior wall MI, what happens is our right side starts working more. So our axis is deflected towards right side. Okay. Let's look at another example. For example, due to some cause, maybe pulmonary stenosis or pulmonary hypertension, we have our right ventricular hypertrophy. This right ventricle increase its size. So what happens is our axis starts moving towards the right side. So again, in right ventricular hypertrophy, we can have our axis in this direction. Similarly, if we have left ventricular hypertrophy or our left atrial enlargement, we will have our axis deflected more towards the left side. So what happens when we have a northwest axis or extreme axis deviation? You know, we talked about ventricular rhythm or ectopic foci firing or Purkinje fiber firing, anything that is north sinus. The current is flowing in all directions. So we start having our axis in this direction. So northwest axis is important during our ventricular rhythms, for example, ventricular tachycardia, ventricular fibrillation, and other such arrhythmias. So let's go to ECGs, I think. Here is our left axis deviation. So I'm going to tell you the easiest way to determine the axis of ECG. I told you before that we are going to talk about two leads, lead AVF and lead 1. So if we hold this ECG paper in our hands, our left hand would be on lead 1 and our right hand would be on lead AVF. Right thumb, sorry. Our left thumb would be on lead 1 and our right thumb would be on lead AVF. So if lead 1 is positively deflected, we keep this left thumb up, and AVF is negatively deflected. Okay, so AVF is negatively deflected, but lead 1 is positively deflected. We will take the thumb that is pointing upwards as the axis. Since it's my left thumb, so there is left axis deviation. Okay, whichever thumb is up, we call it axis deviation towards that side. Since my left thumb is up, so it's left axis deviation in the case when lead 1 is pointing upwards and lead AVF is pointing downwards. So just reverse the role. We have AVF that is pointing upwards, okay, and our lead 1 is pointing downwards, right? Since we have upward deflection in lead AVF or our right hand, we will call it right axis deviation. Okay. So what happens if both lead 1 and lead AVF are negatively deflected? Since my sign is showing that it's a terrible thing, so we will call it extreme axis deviation or northwest axis. Okay, this is the easiest way to determine the axis. Okay, let's look at this ECG for a while. So you can see that we have a negatively deflected lead 1 and a positively deflected AVF. You can say that here is a little bulge that is pointing upwards, but we are going to take the wave that has the highest amplitude. So in this case, lead S has highest amplitude and it is negatively deflected. So our left side is negatively deflected and our right side is positively deflected, right? Lead AVF is positively deflected. So as our right thumb is pointing upwards, we can call this a right axis deviation. What? A right axis deviation. So this is the easiest way that you can tell what is the axis of an ECG. And I hope you learned a lot from this video. I will see you in the next one. Thank you.